Many thanks for your warm welcome, and thank you very much to Highlands and Islands Enterprise and to the sponsors for inviting me to speak today. So as you've been told, my focus is going to be on rural community resilience, and shaping the future around lived experience is my subtitle. And I'm absolutely delighted that, Lauren, your focus and the film that has been put together is really around people's lived experience, what they experience on a day-to-day basis, what they think, what they feel, and I'm going to be talking about that. So here's today's storyline, looking at community resilience over a 40-year period. You'll be relieved that's only going to take about 5 or 6 minutes. Then 3 examples of evidence of lived experience and how that relates to community resilience. And then asking, well, so what? I've told you a bit of a story. What does that mean for what and how we think, for what we do and how we do it? And then what next? Where does that leave us? So let's look at the 40-year journey around community resilience thinking. So it's become far more popular as a term in research and particularly in national policies. And I wanted to spend a little bit of time unpacking it. And I had a check with the conference organisers first that this was okay. It's seen as a key route towards sustainable rural development, and resilience and community resilience is seen as a positive quality which communities should reach for. It's seen as desirable and increasingly necessary that communities must be resilient, and especially with less public sector resources and greater national and international uncertainties. So what is community resilience? It's a term we hear bandied around so much, and I wanted to just spend a few minutes looking at it. These slides might well be circulated, so for those of you at the back who can't really see this, it's the shape I want you to see. So from the left to the right, in the 1940s, there was really a focus on physical systems through to the 1970s, 40 years, 70s, 1970s. There was a focus on ecological systems and on physical systems in maths and physics. So people were looking at metals and saying, if we put pressure on them, do they bounce back to the same shape at a molecular structure, or do they change shape? Looking at ecological systems, the stresses on them, when they experience that stress, do they change or do they go back to the same shape? So humans weren't being looked at in these systems. It was only when we get into the 2000s that they start to link humans into those systems and say, okay, if we look at the east coast of North America, if those ecological systems are overfished, what happens then? How do they recover? How do humans interact with the Amazon, for example? So we start to see a link between ecology and humans. So these are called socio-ecological systems, and what happens at different scales. And it's only as we then come through to 2015 to 2018, we start to see something called human agency systems. And all that means is people start to be seen as the drivers of change and those who can bring about change in those systems. And they are seen, humans are seen as those with choices, who can dream, who can imagine different futures and actually plan for those futures. So it's not just about a shock and reacting to that shock as a system, it's actually imagining a future and planning for that future. So that's a big shift over 40 years. So this is the area where quite a lot of research is now going on as humans as drivers of change. You might think that's blooming obvious. You know, you're out doing that on a day-to-day basis. But as ever, academics take a while to catch up. So it's taken us 40 years to catch up with what you're doing on a daily basis. And here's a definition by someone from Portland, Oregon, working in forestry. And I'll just be quiet for a moment so you can read that. So the words in bold are really important. Unpredictability, surprise, uncertainty, intentionally develop new trajectories. That was actually one sentence, typical in academia. I broke it into 2 and made some words in bold. But the key points there are about humans deciding to make change. Let's unpack it just a little bit more for 2 or 3 minutes. Communities live in a context of disruptive change, which can be rapid or slow burn. So it's not these single shocks, it's constant. Change is happening to us constantly. We have varying degrees of control or agency over what happens. And resilience is a process where resources are balanced with vulnerabilities. It's, we have some strengths, we have some weaknesses. We're constantly balancing those as individuals and as communities. And our human agency, as it's called, is key to that balancing act, where we can imagine, dream and plan and make deliberate choices. There are general principles associated with human agency. We can learn, adapt, we can recognize and change, we can create positive directions of travel. We're able to bounce forward, not just bounce back. We can function in the midst of crisis. And we can collaborate with relevant stakeholders. And these examples that you gave demonstrate community resilience. And then other literature talks about interlinked supporting factors. Some of these we know really well: social capital, economic capital. I won't list all these, but there's connections between people and places, leadership and community infrastructure. So this is a summary of dozens and dozens of papers, and if you want, those who are really into this, I can send the links to those. So this is a summary of the key points of how we're now thinking about community resilience. But let's remember that conventionally, the dominant way of talking about resilience is bounce back from external shocks. So when it is used, that's how most people are still talking about it, rather than this proactive human agency. So most people are still thinking it's about you and I recovering from an external shock, rather than the more proactive, positive, forward-looking approach. Remember, human agency is unequally distributed. We don't all have the same access to being able to make change. Communities have unequal power relations within them and between them. And something that's come through very strongly from the literature is there are normative pressures. What is the norm? And I'll come on to this key quote before I finish on the literature. This is from a guy called Kaplan, which we may talk about again in the discussion. He says very strongly, resilience has no meaning except in relation to more or less desirable outcomes. Resilience is defined either in terms of having approximated to desirable outcomes or distance yourself from undesirable outcomes. So it's not value-free. Somebody's deciding what's desirable and what's undesirable. So we have to ask, what are seen as desirable outcomes? What's seen as good? Desirable for whom? Who decides what's desirable? So we have to listen to multiple views of what's desirable and other people's lived experience, because policy is saying it's desirable for communities to look like this. Our communities feeling it's desirable for them to look like that as well. We have to dig a bit deeper. So we need to listen to lived experience. I'm going to very quickly give you 3 examples of evidence of lived experience. The first one is research that some of you took part in, thank you very much, and some of you will have heard about, called Recharging Rural. And this was a report that I produced for the Prince's Countryside Fund, and it looked across the whole of the UK at what remote rural feels like. So it's how do you experience remote rural, and how are you planning for 2030 and beyond? And I'm presuming these slides will be made available, so I've put the links on there for you to find the report. And we had over 3,000 responses to that. And the barriers and future challenges will be all too familiar to many of you. Poor broadband and mobile phone coverage, poor transport, poor employment opportunities with little scope for progression. And we experience these, they told us, in combination. And in combination, they lead to the outmigration of young people. The future, we see little or no change, actually, in all of that. We see tinkering around the edges, but nothing substantive. And there's a snowballing of decline, so they're building together and leading to decline. And there's underinvestment, so we have a lack of affordable housing. There's rural poverty and social isolation. So how are you experiencing that, we said? Describe it and then tell us what it feels like. Well, we need a car. Infrastructure is limited or poor, digital connectivity is poor roads, we're dependent on ferries. And these, they said, are disabling characteristics. We feel disabled by this, and they combine to make life more challenging. So we don't think of transport and broadband and housing. They actually join together and disable how we want to be and move. And we also feel socially isolated. And two key things came out. That there's a layering of geographical and personal factors for people. You might be isolated on a map. You can also be isolated as an individual, economically, socially, due to your health, mental or physical health. So if you just put a place label to where you are, you might be remote on a map, you have to layer that with your own personal remoteness too. And the other thing that people told us, their lived experience, is that remoteness is a process that's happening to them. I can do nothing different in how I live in my community for 10 years, but I become more remote because of the changes that are happening round about me. Centralization of services, reduction of services. So I become remote even though I've changed nothing. A key ask that came through is to listen, understand, and respect us and put what they called a soft infrastructure in place that's as essential as the hard infrastructure of roads, broadband, and so on. Listen to those of us who are experiencing rural life daily, and this is what this conference is doing. Find us, ask us, hear our grassroots knowledge. Let's connect and network at a very local level with support to build our confidence in doing that, because not everyone can do that. And let's connect across the UK to share our knowledge and expertise from the ground up. We want to tell people what it feels like to live in remote rural UK. Let us do that, make it easier for us to do that. The second example comes from the Highlands and Islands. Again, thank you to those of you who took part. I was going to get Fiona Thompson to wave, but I can't see anybody here now. So this study was undertaken with Scottish Rural Action and Fiona Thompson. If she does wave, you can't see. But anyway, this was undertaken for the Scottish Government. And we looked at how people use air transport to and from the Highlands and Islands, how important air transport is to them, and views on what could be done differently. Again, a bit of tell us how it is, and then tell us how it feels. And the respondents were distributed on the map, as you can see, and there were nearly 1,500 respondents from the Highlands and Islands, a very targeted survey, so a very high response rate. There are benefits of air travel that people describe to us. We can get from the inside out, and it brings people from the outside in. It reduces isolation. It allows for business development, employment opportunities, commuting, and gives us career opportunities. It allows for time-critical meetings, including health-related ones. How do we experience air travel? Well, it's a lifeline, not a luxury. Again, if I could do a show of hands, it'd be interesting to see how many people came by air or would have loved to have come by air travel. Air travel overcomes isolation for us. It addresses our personal remoteness. It keeps us in touch with the outside world and the bigger picture, so we don't feel so remote from what's going on outside of our own world. And it keeps remoter areas on the map in terms of cultural festivals. We wouldn't be able to attract people if we couldn't use air travel. And it's proportionately more important in rural and island settings where weaker infrastructure and fewer services exist. So the positive impact is even greater. But more than 80% of survey respondents want or need to fly more. But they can't due to ticket costs. Many told us that it's more expensive to fly from the island to the mainland than it is from the mainland to a far-flung part of Europe or even to the Far East. And also, depending on whether you book a month ahead or a week ahead for the same seat on the same plane, the prices are phenomenally different. Reliability is not what it needs to be, and the timing of flights doesn't allow for daytime meetings to take place. So people find these things, restrict them, make them isolated. And numerous experiences are given of that in the report. My third example of experience data is around mental ill health in rural Scotland. And this was carried out with Support in Mind Scotland, the national charity that supports over 1,500 people a week experiencing mental ill health, and 80% of those are in rural Scotland. So we carried out a national survey in 2016-17 to find out how people with mental ill health experience their day-to-day life in rural Scotland. So the focus wasn't on services, it was on how do you feel living in rural Scotland with mental ill health. We had hundreds of responses from across rural Scotland shown on the map. People right now, as we sit or stand here, are experiencing depression, suicidal thoughts and feelings, and self-harming behaviour, no matter their age, gender, or rural location. And rural isolation is made worse by remoteness, stigma, and fear. Those are the headlines, if you like. And people want to connect in low-level ways, locally, in non-clinical settings, pre-crisis. Most respondents to the survey are in employment, and this took us a little bit by surprise because there's usually quite a strong link between those experiencing mental ill health and not being able to work. However, the majority in this survey are at work and experiencing these challenges. And we found that their remoteness is not only geographic. This, on the left-hand side, is the Scottish Government's classification of rural. So at the top, you've got remote rural. At the bottom, you've got urban. And you might have expected a kind of line going down diagonally, because at the top, we ask, do you consider yourself to live in a remote rural area? So as you get closer to urban, you'd think, okay, you have less people saying, yes, I feel I live in a remote rural area. But actually, we have 80% of people saying, I live in a remote small town, but I actually feel I live in a remote area. So it's not a linear link between whether you are geographically remote and whether you feel remote. Communities give support to people who experience mental ill health. Some of them talked about good banter, supportive or close communities, feeling safe and at home, having close friends, strong community links. At the same time, an equal number of people talked about nosy neighbours, it being embarrassing when people know you're too ill to work, parochial attitudes, lack of privacy, judgmental neighbours, and everyone knows everyone's business. And linked with that, we asked, do you feel you can be open about your mental health problems in your community? And more than double those who answered yes, answered no. I cannot be open about my mental health problems in my community. And a key finding that came out when we said, if you can change one thing that would make your life better, your experience better in rural areas, in mental health services, what would it be? And the key take-home message is we want to connect. We can't be open, but we want to connect before personal crises occur. Close to the place of need, including mobile services outreach, particularly on the islands, because we heard a lot about the trauma of actually using public transport, crossing your threshold, waiting for a bus, getting on a bus, not knowing who's going to be on the bus as well. We want mental health care mainstreamed and parity given with physical health care. And we want to focus on children and young people, and we have some here today, particularly focusing on self-harm and reducing waiting times. And what's your key message for policymakers, given your experience? Listen to us and respect us as service users. It's an invisible illness, made more invisible by being rural and remote. And mental ill health does lead to death. Those aged 24 and under sugarcoated nothing in their responses to us and made this link very clear for us. We need shorter waiting times, and we want low-level contact out with hospital environments. We want you to make the invisible visible. That was their key ask. So I've given you 3 examples of lived experience evidence. So what? What does this evidence mean for what and how we think, what we do, and how we do it? Do we just leave it there? We say that was interesting. What do we do? For what and how we think, it's clear that there's great complexity. It's clear that there's diversity in people's experiences, and that we need to build in somehow a respect for people's world views, that they are different, that people see the world differently, they hear it differently, they think differently, and that not everyone starts from the same place, and we'll see why this becomes relevant. For what we do and how we do it, therefore not expecting all communities to take the same path, The image on the left, if you can see it, is of an 8-armed female inspiring community innovation. She has steam coming out her ears. She's holding multiple lists. I think she's digging some plants. She's answering phone calls. She's planting seeds. She's doing multiple things at her community level. There's an expectation that all communities should be taking this same path. On the right-hand side, we have communities in Sutherland digging their own broadband trenches. And I may be controversial here, or be perceived as controversial. I think we need to query whether communities should be digging their own broadband trenches. Is it right that we should be expecting communities to provide their own services and actually be celebrating it in the national news? For discussion, we have a panel session afterwards. So that's what I feel we shouldn't be doing. What we should be doing is seeking out and building in lived experience evidence in the way that we're doing in partnership with others, in the way that this conference is doing, and using this to shape policy design and its implementation. We have a framework in Scotland, a national performance framework that's been in place 12 years now. And we had outcome 11 until last year. We have strong, resilient, and supportive communities where people take responsibility for their own actions and how they affect others. This was modified last year to we live in communities that are inclusive, empowered, resilient, and safe. This is a strong outcome that's been in place for 12 years now. When we look across, as I have done, annual programme for governments and the economic strategy, we see a whole set of language around communities that is only positive. So there's little room for manoeuvre to be anything else. So communities are and have a huge reservoir of talent. They're doing it for themselves. They're leading change. They're strong, resilient, and supportive. They're living together in peace. There's cohesion, there's social justice, they're delivering growth, and they're enjoyable and sustainable places to live. There's no room for anything else. If you live in a community that you find oppressive, as we saw from the evidence, or you can't move, or nothing's happening, where do you find yourself in the dominant messages that are coming out here? Where's the support to be different, to move to a different journey, or to recognize even that you don't find a place on here? It's very difficult. So we have to use lived experience evidence to check how or whether all rural communities can be resilient in the way that's expected by policy, by funders, and service providers. We have to use such evidence to ask whether all rural communities can equally take advantage of community empowerment frameworks. There are emerging inequalities. There's evidence of this. We must seek out the invisible and the silent and do that through generating evidence. Lived experience evidence is showing disempowerment, where the already empowered are being more empowered. They have the keys. They're getting more empowered. We can see this in some leader programs, where communities who know how to use the system, if I can be blunt, are using it well and coming back for more and doing well. And national empowerment frameworks with inclusion is only phrased as guidance and not as legislation. So local government or other public body players or other sectors don't have to do this. They can do it, and HI is an agency that does do this, but other bodies don't have to. So if you haven't got these tools and these support mechanisms, what happens? And here is one of my favorite pictures. Those of you who've seen me speak before know I use this one of summing up Darwin's theory of evolution. You have the long-necked giraffe being able to reach the long-necked tree. Sorry, the tall tree. I've invented a new plant. You have the long-necked giraffe being able to reach the top leaves of the tree. The short-necked giraffe can't. Ultimately, the short-necked giraffe dies because there isn't the support system in place for that giraffe to reach. Is that what we're seeing, Darwinian development, where only those who can use this system are able to survive? So what next? In terms of listening to people, the lived experience data, tell me what it's like, tell me what it feels like. I would argue that given this emerging disempowerment, we must continually put rural people's lived experience on the radar. At the moment, much remains unseen. Statistical data are far more trusted than lived experience data, and I frequently come across this situation. There is a gender subtext there, for those of you who wish to see it. I will say no more. There is a hierarchy of evidence, and that's a real challenge when we're trying to show rural complexity. We have the Scottish Index of Multiple Deprivation, which some of you may have strong feelings about. What we find now is the Scottish Government, I can't see, I was going to ask them to wave too, but obviously I can't see now. They have the statement now that for Orkney, Shetland and the Western Isles, there are no deprived data zones in these council areas, but there are still people experiencing deprivation. Who knew? But there's nothing more said about that. Where do we go in terms of generating evidence about this? It's not enough just to state that. Similarly, they state, not all deprived people live in deprived areas. 2 out of 3 people who are income deprived do not live in deprived areas. What do we do about that? Do we just say, oh, the stats aren't enough? What do we do about that? These are people we're talking about. There's a hierarchy of policy evidence. The sort of data I've just been talking to you about, if you look down this diagram, it's called suspect data. It's suspect because it's a case study or it's a non-peer-reviewed report. When I presented the mental health evidence to statisticians, I was advised that we shouldn't really be taking it too seriously. Firstly, because it was qualitative data, and secondly, because of the source. It was from people experiencing mental ill health. It's suspect data, evidence from a single descriptive or qualitative study. So we have to be assertive about lived experience data. It becomes all the more important in rural settings because rural will never win on big numbers or big data. We have fewer people spread over a larger landmass. We have 18% of the population, over 92% of Scotland. So individuals' experiences are disproportionately significant. So we have to be assertive about these data and their impacts. And just to give you some encouragement about the impacts, the rural mental health data, in spite of that knockback, have led to rural going into the National Mental Health Strategy, Scottish Government strategy, for 10 years. Have supported the development of the National Rural Mental Health Forum, and there are many members here today of the over 100 organisations now, and support action research taking place within rural communities, working with those with lived experience of mental ill health, asking, how do you want your experience of rural Scotland to be different? And it's also made its way into a House of Lords report on the need for a rural strategy for a rural economy. So we can see, if you push, lived experience data can make its way through. So in conclusion, one of my heroes, if you can see that, we have, as well as our national performance framework outcomes, we have a core value in Scotland. We are a society which treats all our people with kindness, dignity and compassion. And I want to put irrespective of location. All our people, that includes in rural Scotland. We also, in Scotland, have signed up to the UN Sustainable Development Goals, which includes number 10, reducing inequalities, number 11, sustainable communities. We have committed to these. So we must have, in order to deliver to these alone, let alone the other drivers, evidence driven by social justice. Yes, by all means, define people by numbers. We also need to know what people think, and it can be glorious. You can see here, fantastic image, what's inside our heads, and what they say, which can be a couple of dots. And the difference between these, we need to dig a bit, because people don't always say what they think. We need to dig further and find out what they feel and why. And that's our responsibility in order to deliver social justice and support community resilience. Thank you.